Welcome to Project Health Live, sponsored by Penn State Hershey Heart and Vascular Institute. My final guest this evening is Dr. Edward Stevenson. Thank you so much for joining me. We've heard a lot about heart health today, and I want to follow up with some very basic questions. Can you tell me what happens if a stent can't be placed?
If a patient's had a heart attack and a stent can't be placed, one of the options that we do have is open heart surgery or coronary artery bypass grafting.
And coronary artery bypass, can you tell me a little bit more about that?
What this type of surgery is taking a blood vessel from another part of your body, usually the leg or the chest wall, and using that blood vessel to bypass the blockage in the heart that caused the heart attack. We don't do anything to the blockage itself. The blockage stays where it is, but the blood uses this new blood vessel to get to the heart and supply it with all the blood that it needs.
So if somebody has a heart attack, is this the only option that they have?
Certain people aren't candidates, depending on their other medical problems and other issues, but it's a good option if they are not candidates. And another option is to use medications and optimize the patient's medications to prevent their symptoms, improve their symptoms, and improve their quality of life.
Okay, so if somebody does happen to have a coronary bypass surgery, does that mean they're scot-free and then go back to living life the way they were?
No, unfortunately not. The dietary modifications, the lifestyle changes are all very important to keeping those new bypass grafts open, keeping the heart healthy, and so we encourage people to continue to eat healthy, modify their lifestyle, and help prevent further heart disease.
So it sounds like a good time to keep those New Year's resolutions.
Absolutely, absolutely.
Fabulous. Well, thank you so much for all the information that you've given us this evening.